Most of the time, people don't realize that you're not knocked out. Probably only about 1 out of 10 sports concussions do you get knocked out, lose consciousness. The rest of the time, you're walking around and maybe only slightly dazed or have a headache or be confused. There are other symptoms which later may be picked up, but many times it's very subtle, and it's a hard diagnosis to make. It's hard for the athlete or his teammates to know. It's hard for the coaches and trainers and the team physicians to sometimes know. It's hard for parents to sometimes know. So athletic concussions can be subtle in their manifestations, but nonetheless, they're a brain injury with many potential implications and potential problems down the road.
If a player keeps playing and he doesn't realize he has a concussion, what can that lead to?
Well, there is something called the second impact syndrome, which is very rare, but that's where you get a second impact, a second brain injury on top of the first, either the same game or maybe the next game or next practice in close proximity. And that can lead to brain swelling, even death. Now that's very rare. But the more common problem we worry about with concussions is that getting a concussion on top of one that hasn't healed is where we think the risk for prolonged symptoms such as headache, memory problems, problems concentrating, difficulties at school, maybe visual disturbances, balance problems, memory. So all these things we think are more likely to occur when the athlete has not healed from the first concussion. And that's why we always say the athlete needs to be asymptomatic, no symptoms, especially for a period of time before they go back to play again.
What exactly is that wait period? Is there a mandatory wait period?
Well, it's individualized. A lot of times it's about a week is the usual time period, but it's different in every case, and in nearly every case we individualize it. But we want the athlete's symptoms to all go away, implying that his brain function is back to normal.
What are some of the best ways to avoid concussions?
Well, the best ways is probably not to get hit on the head, and so avoid sports or athletic activities where you don't have that risk, but not everybody wants to do that. And all of these sports, I look at contact sports as being football, ice hockey, boxing, or full contact karate. These are sports where you, by the design of the activity, you're supposed to hit heads. Then there's another bigger group I call collision sports, where you don't hit each other on the head on purpose, but to run into one another or to run into a goal post or some other object or hit the ground is very common. The collision sports are soccer, the most popular sport in the world, basketball, baseball, rugby, and lacrosse, or others where you're running and you can very easily collide. And so those are collision sports where concussion can also occur.
Receiving multiple concussions, does that lead to other diseases? I don't know if you call them diseases, but brain dementia, Alzheimer's?
Well, it again is rare, but there's a syndrome called chronic traumatic encephalopathy where the brain doesn't work, and we believe that's from multiple traumas. We've done a lot of work here at WVU on looking at the brains of athletes who have died, former athletes, and we found in the cases where they had emotional and psychological problems, depression, in many cases they committed suicide. We found that some of those have very consistent brain damage, and it's similar to what patients with Alzheimer's get, but it's not Alzheimer's disease. It occurs at a younger age, and it doesn't have all the microscopic traits of Alzheimer's, but it's still a form of dementia. We continue to study that. We think there's a lot more work to be done. But that's rare, but that's the worst case scenario that we do, in fact, worry about.
Do you think players and parents realize the severity of head injuries in football and contact sports?
I think that parents and athletes are more than ever beginning to get it, that we don't like to consider a hit on the head like we used to as a ding, as something minor. I always say you can ice your ankle, but you can't ice your brain, and the brain's the most important organ you got. So I think that through all the publicity and the news accounts and the unfortunate athletes we've heard about, that there is the better perception now that concussions are very common. The CDC in Atlanta said that there are an epidemic of sports-related concussions, whether it's organized sports or just recreation. I think they recently said up to 2 or 3 million concussions occur in sports every year in this country. So I think there is more recognition. I think there's recognition of the potential for long-term health issues and detriments, and that this injury must be taken seriously and recognized, and the athlete handled very carefully, and he or she should not be returned again until all the symptoms have cleared.
So you think organizations at the high school, college, and NFL level are taking, I guess, better actions to?
I think so. I think at every level there's been actions you can point to, whether it's changes in rules or education, that each have taken. We'd like for them to take more. We'd like to continue to push this so that there's recognition and hopefully a movement towards more prevention or elimination. In football, for instance, the velocities have become so great, in my opinion, that they have led to extremely high-level collisions and imparting of energy. And I think that, you know, we've got to look at taking the head out of the game. I think that's ultimately the prevention. So we've got to look at rules changes and techniques and style of play to prevent this obligatory head contact.